Hi friends, I am Dr. Prashantha from Naipunya City Clinic, Bangalore, India. Let me share with you a heartwarming story which happened almost a decade back, I think. He is a very dear friend of me now, a senior physics professor, and he weighed 168 kilos. So he had consulted a lot of doctors and he came to me and I referred him to a bariatric surgeon. Bariatric surgery is where we cut the stomach and reduce its size to about 100 ml, from 1.5 liters to 150 ml. So you can't eat more than one idli or half a glass of milk or anything. Another kind of bariatric surgery is where the absorption is bypassed. So he was ideal candidate because his weight 168 and he had diabetic, he was hypertensive, he had a single functioning kidney. That is, instead of two, he had only one kidney. So when obesity is there with metabolic problems, best way to go about is to go for a bariatric surgery. So I promptly suggested him and sent him to my colleagues who would do bariatric surgery and told him, if there is any sagging, you come back after 1 year after bariatric surgery, we will do the body contouring. So an interesting thing happened. He disappeared for 2 weeks and then he came back with his brother. He told, doctor, I consulted the bariatric surgeon you suggested and another 2 bariatric surgeons also in Bangalore, but I don't want to live my life like that. I don't want to take supplements every day. All that I want is more mobility and I want to eat masala dosa and whatever I want to eat. I want to enjoy my life. You do whatever you can. Even if 5 kg of weight is not reduced, I will not hold you responsible. So this was a very tricky situation for me. Because first of all, very high risk patient, because diabetes on insulin and hypertension, single kidney and such a huge weight. So I told him, sir, like in all aspects you are a high risk patient. And what we are going to do, risks are more than the benefits you are foreseeing. He said, I will not hold you responsible. You do. And I trust you. You formulate whatever you can. So we began preparing. We began with lung exercises to increase his lung capacity. We did counseling so that he could change the trajectory of his life. Very intelligent fellow, very loving fellow. Then we started scrubbing and decontaminating under the abdomen, which had a lot of fungal infection. And he started walking. You know how many steps? Maximum we could achieve was 7 steps. This is before surgery. So with lot of risk, we took him up for surgery and we planned it in double level epidural with all the backup. So I told him, sir, I will put my 100% effort and remove whatever possible safely. He said, okay. So I removed the fat from the lower abdomen and upper abdomen and the flanks. A total of 20 liters was removed just from abdomen and flank and from the back. And I removed the lower portion of the abdomen, which weighed a good 4.5 kilos. So 18 kgs of fat and another 4 of pannus was removed. And so effectively his weight should have dropped from 168 to 146. His weight dropped only to 148. And post-operative period was little stormy. He had wound healing issues, like which needed me to put stitches again after about 2 weeks at about 2 to 3 centimeters, which was okay. There was no major infection or anything. So he recovered within a period of 4 weeks after this massive thing. And then I did not see him after the first month follow-up. After 3 years, he comes back with a weight of 95 kilos. what was removed with body contouring and abdominoplasty was just 22. He has from 168 to fallen to 95. A loss of 73 kilos. I was stunned. So he told doctor, before removing the pannus, I could take 6, maximum 7 steps. And I have never given a lecture standing. And there was so much problem at home that we had to alter the door to fit me in. So after this procedure, like now I can walk. I don't have to lift my abdomen to sit. And that has increased my mobility. I walk about 1 kilometer every day now. And you know what? I am off insulin. Blood pressure is under control. I am living a very good life. So he wanted to come and tell everybody that such a transformation happened because of this partnership. So he came to one of the local TV channels interview, and he himself wanted to tell it to other people. After he went public and spoke about this, thousands of people like him have benefited from Punya. I always remember him very fondly and thank him for what we had done as a team. Friends, it is not always just the doctor or the surgeon or the hospital or this one. Most important factor in your journey like this, transformation, is you. You should find a surgeon who can team up with you, who has skill, ability, and a mindset to partner with you, to listen to you and understand what you need. Then together we can make miracles happen like this one. All the best.